Hi, welcome to this unique hair care initiative by IPCA. I'm Mona Sharma, and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, hair problems was associated with middle age when you used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in our work life, we are now seeing hair problems even at a younger age. It is not uncommon now to see 25 to 30 years old people facing hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided and can be fixed by managing to modify our faulty lifestyle. Today, we have with us Dr. Shraddha Sonani is a well-known doctor based in Mumbai who specializes in dermatology. She has been practicing medicine for over 11 years now. Dr. Shraddha Sonani currently practices at her own clinic as consultant dermatology and cosmetologist at Revive Skin Hair Clinic and Laser Center at Sharanpur Road and Nashik Road. Dr. Shraddha Sonani has completed her MBBS from TNMC Nair Hospital, Mumbai, and DNB Dermatology from Seth GSMC KEM Hospital, Mumbai. She has a wide variety of expertise in treatment of skin and hair care management with special interest in clinical dermatologist, trichologist, Botox, filler, mesotherapy, chemical peeling, and derma roller for acne scar. Dr. Shraddha Sonani is aware of the need for the patient awareness and education about hair care and give multiple talks at various platforms across the country. Thank you, Dr. Shraddha Sonani, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to the show.
Thank you.
डॉक्टर हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया. So doctor, today we are going to discuss the hair care in current scenario. So when we talk about hair care, the first question come up to our mind is like the hair loss. So how common is hair loss and what's normal and when to be concerned for?
Yeah, thank you, Mona, for introducing me. The only thing I want to specify is I practice at Nashik and not in Mumbai. I have my two clinics in Nashik. At Sharanpur Road and one is at Nashik Road. So I have got my education from Mumbai, but now I'm practicing in Nashik since past 11 years. And hair loss, as you said, that is a major problem in today's world, especially after the COVID pandemic. Hair loss cases have risen to a next level. Almost 30% of the patients visiting my OPD on day-to-day basis come up with problems of hair loss. Even children, previously, as you correctly mentioned, it was only a problem for middle-aged people. But nowadays, children from right from the age group of 6 to 7 years also are coming up with hair loss issues. So I think hair loss has definitely increased over the past 5 to 10 years.
So, doctor, like you said, it has been increased, but what is that alarm sign that okay, now it is like we should go to the doctor, like we because everyone is
yeah. Yes, people feel that more hair they are losing every day, but we generally, as a dermatologist, have kept a benchmark that 100 hair per day are normally shed by every human being. So if you are losing more than 100 hair a day, then only we consider it as pathological or worthy of treatment.
Okay. Okay, good to know, doctor. So, doctor, like hair loss is increasing, but what are the general causes of hair loss?
We always divide it into two types. One is a hormonal hair loss, which is also called as androgenetic alopecia. Alopecia, by alopecia, we mean hair loss, So we are losing hair, that means alopecia. So androgenetic alopecia is usually hormone driven. So it is a hormonal kind of a hair loss. This is usually genetic or it happens due to hormone imbalances in women. Androgenetic alopecia is very common in men but nowadays it is also increasingly seen in women. The other type of hair loss is also known as telogen effluvium. Telogen effluvium is the kind of hair loss that we saw a lot after COVID pandemic, after or in between COVID pandemic. So telogen effluvium is a kind of hair loss which we see when a person goes through a period of stress or any kind of illness or any kind of surgeries, accidents, or some kind of mental trauma. So after the period is over, a person experiences a lot of hair falling, so much so that hair volume or density goes more than 50% down in a matter of few months. And you can start seeing your scalp overall, on the entire scalp, you can see the density has gone down. This is the commonest type of hair loss which we saw in COVID pandemic. It can affect you after any kind of illness like dengue, malaria, typhoid, jaundice, or COVID was one of the things which everybody was getting affected with. But even the stress of getting COVID, just the fear that I might contract it was giving people hair loss during the pandemic. So these are the basic two types of hair loss that patients normally come up with. Then there is third type, which is also known as alopecia areata, wherein you get round patches of total hair loss, which is more common in children up till the age of 10 years. But it is also seen in adults with stress or thyroid disorders. So these are basic groupings of hair loss.
Okay, so other form of disorder can also lead to hair loss like thyroid. Okay.
Yeah.
Very informative, doctor. So, doctor, like we have talked about causes and hair loss. So, can a person lifestyle also play a role in hair loss?
Yes. Rather, a person's lifestyle only has become the biggest factor in hair loss nowadays. I would like to say this sentence because most of the jobs or lifestyles have become sedentary nowadays with the availability of vehicles or the kind of luxurious lifestyle that we lead. But at the same time, nutrition in our diet has taken the toll. Newer lifestyles involve a lot of work hours, a lot of stress and pressure to perform, wherein we don't have time to cook or buy freshly prepared or fresh vegetables from market or fresh meat to eat. So most of the foods that sedentary lifestyle individuals are consuming are in the form of maida, processed cheese, processed butter, everything that is packed in plastics, ready-made food, ready-to-heat food items, or most of the times we are eating out, which involves a lot of junk food exposure. So the quality of nutrition has definitely taken toll in the new era, wherein people don't have time to cook for themselves, or probably they don't like to eat that kind of food. It's called westernization of Indians, the way we were being taught to eat by our ancestors, we don't like to follow it nowadays, I feel. So the amount of fruits, the amount of fresh veggies, the amount of fresh meat is going down in our diet. And as we all know that the general nutritional status of the food available in the market is also going down due to a lot of use of pesticides and a lot of fertilizers. And so as the old people in our house would say, आजकल के खाने में वो बात नहीं रही, ना उसमें स्वाद है, ना उसमें दम है. So I think I agree somewhere.
Yes, so food is really important for
really food and stress. The amount of stress that people have nowadays, a kid going to school is more stressed than what our parents were when they were doing job, I feel, because performing pressure is there not only on us adults in scenarios where we are working, but it's also there on the kids nowadays, a lot, that too.
Yeah, we agree to it. So, doctor, we are talking about the lifestyle, and so many, problems are there for causes are there for hair loss. So, doctor, like, what are the treatment options available for hair loss? Is there like topical, surgical, or non-surgical, or is there some oral also, like we can eat and manage our hair loss problem or care for
Yes.
our?
Yes. So when a patient reaches us, Mona, already they have tried everything that is available on internet or that is available online. A patient never directly visits a dermatologist in our country. We are more influenced by TV nowadays, internet, Instagram, YouTube, and I hope such authentic kind of content that you are trying to make is reaching more people than the fake advertisements that are going viral every day. So what happens is when a patient reaches dermatologist, they have already lost all hope. They think that they have tried everything available in the world and they have now no choice but to visit a dermatologist. It should be I think little ulta, but doesn't happen in our country. So when they come to us, the first line of management we always try to do is giving some oral medications to improve the nutritional status of the person. We try to analyze whether the person has some kind of deficiencies that is leading to this hair loss, whether they have any hormonal issue, some hormonal imbalances going on in the person's life, which is leading to this kind of hair loss. Whether that person has gone through any kind of stressful event. So we try to take a lot of history. We try to understand that person's lifestyle. We try to understand the type of diet that they are consuming. And then we try to give a comprehensive approach. By comprehensive approach, what I mean is we also give them oral tablets to correct some deficiencies. We give them some topical applications, some lotions, some mild shampoos or cleansers to cleanse the scalp with. We try to treat their dandruff if there is any. And with all this, we try and comprehensively manage a person's hair. In non-surgical modalities, we do treatments like mesotherapy, wherein we are trying to help the patient to whatever we have prescribed. Maybe it might be minoxidil or it might be bioactive peptides. The solutions has to reach the hair roots. The hair roots are at almost 1.5 to 2 millimeter depth in the scalp. So whatever we apply on an intact scalp, it only reaches 20 to 30% to the roots at the root level, where actually the problem is happening, where the blood supply is, where the nerve supply is. So our hairs get nutrition at this level, the root level. So we try to do micro needling procedures like derma pen, derma rollers, or PRP therapies, which help to reach at the hair root level. And the channels that we create with the needles also help the person to effectively apply the medications, which will directly go down through these channels to reach the hair roots. So this is called mesotherapy and PRP treatments. Then again, in surgical management, we do have hair transplant surgeries. When we have already done medical line of management and non-surgical modalities for 6 months, 9 months, or a year, and still we want more density on our scalp, may it be men or may it be women, we can go for hair transplant surgeries, wherein we take the hair from occipital region or any other body areas, and then we transplant it into the crown area of the person to give a more fuller look. So they are your natural hair, which grow like all other hairs of yours, and they are perfectly your own natural living hair.
Yeah, okay, quite interesting, doctor. It's good to know that we have so many treatment options are available. Instead of self prescription, we should visit doctor and get
Yes.
ours. So, doctor, like we have talked about treatment, and nowadays a word called nutraceutical is getting into like more focus. So, what is like this word nutraceutical, and what is the role of nutraceutical in hair health?
The role of nutraceuticals is becoming increasingly important with the changing lifestyle. Now, just as we discussed, we are going towards westernization of our lifestyles, wherein we are compromising our diets, in terms of freshly prepared food. We are more into eating junk or eating outside or eating packaged processed food is what I mean. So most of the micronutrients that we call are majorly killed when we eat such kind of food. And the quality of food that we eat also becomes a little hampered with the modern, what do you say, the population is so much and we are not able to, produce so much of food. So there's a lot of fertilizers and there's a lot of pesticides being used by our farmers, which is compromising the quality of nutrition that we are getting. So the need of nutraceuticals is increasing definitely. The first and foremost is India has always faced its protein energy malnutrition. So what I mean by protein energy malnutrition is it usually was always seen in little lower socioeconomic class before. But nowadays, what happens is protein deficiencies are seen in well-to-do families also, because majority of Indian diet is made up of carbohydrates. So we are, always we have focus on आपने कितनी रोटी खाई, आपने कितना rice खाया, उसमें we try to measure the kind of food. अच्छा, 4 रोटी खाई मतलब अच्छा खाना खाया. That is what is our primitive thinking, because we were always hardworking kind of a country before, but now the picture has completely changed. Most of us in the cities at least are sedentary lifestyle people. We hardly walk. We have to, go to the gym to exercise and um, complete 10,000 steps a day. Is such a big challenge for all of us. So we don't need all that calories now. But what happens is we tend to put in more calories than we tend to put in more proteins, So proteins are mostly neglected. If you are on a vegetarian diet, then proteins are already on a lower side. But even in people who are eating mixed diet, proteins, the amount of protein to be eaten with various foods is usually compromised. So a faster and quicker way is to pop a pill.
Oh, yeah.
The nutraceutical,
Yeah.
it's an easy way to complete your deficiencies. So it has become a major factor in hair loss treatments today.
Okay, so it can compensate the things which we are not taking in our diet. We can take it through tablets and compensate our.
Yeah, but then, as in Western countries, people always take some tablets, even when they are, having food. So similar lines we are, I think, going. But because holistic approach, if you ask me, is to correct your diet, and, you have to take help of tablets only to recover from active hair loss. But nowadays, I see with most of my patients is that they have to be on those nutraceuticals even after the tide is over to maintain.
Okay, very interesting, doctor. So, doctor, like we've been talking about nutraceuticals. So, what are some of the herbal or like plant extract or phytoconstituent used in management of hair loss, like alopecia?
Yeah, so mostly when we are talking about hormonal imbalance or hormone-driven alopecias, we have the most common, which is called as androgenetic alopecia. So in androgenetic alopecia, what happens is testosterone level, that is the male hormone, which is called testosterone. In men, already we have testosterone, but those men who are genetically pre-imposed, जिनके family में चलते हुए आ रहा है कि माँ के साइड से या पापा के साइड से, maternal or paternal side, you have bald men. So you are likely to get androgenetic alopecia even for yourself. That is the way we call it, androgenetic alopecia in men. So in such men, these phytonutrients reducing dihydrotestosterone levels. There are two types of testosterone. One is testosterone, which is made in the testes of men, which is converted to dihydrotestosterone in the peripheral bloodstream. Now, this dihydrotestosterone, or commonly known as DHT, that DHT via bloodstream reaches the hair follicle roots here on the crown area of the scalp. This is the most susceptible area to androgenetic alopecia kind of hair loss, wherein this DHT reaches through the bloodstream and it tries to make the hair follicle thin. So the hair follicle is this big, but inside the hair becomes thin and it easily falls off. And this testosterone, your own hormone, does not allow the hair to grow back over there. So we try to medicate a person with phytonutrients, which naturally occurring phytonutrients like green tea or grapeseed extracts, which try to reduce these dihydrotestosterone levels without affecting a person's testosterone work in the body. Basically, testosterone is needed for the sexual competency of a man. So we are only trying to reduce the dihydrotestosterone levels, keeping testosterone levels intact. Okay. So phytonutrients like green tea extracts and grapeseed extracts also help to reduce this dihydrotestosterone level, keeping testosterone level normal.
Okay, quite interesting, doctor. So, like you said, green tea extract. So these plant extract like omega-3 fatty acid or green tea extract, do they promote hair growth, or is just to maintain these hormones?
No, I don't think they promote hair growth. I think they, as I mentioned, green tea extract reduces DHT levels, which in turn reduces hair loss. Green tea has itself has no nutraceutical property to promote hair loss, to stop hair loss and promote hair growth. And omega-3 fatty acids, by all means, are basically moisturizing agents. They are not directly related to promoting hair growth. So when we take omega-3 fatty acids, we are looking at softer, smoother skin, softer, smoother hair, rather than stopping hair loss.
Okay. Quite interesting, doctor. So for softer and healthy hair, we can take these plant extract. So doctor, like we have been talking about this plant extract and all. So even does the micronutrients also play a role in hair health?
Yes. Yes. As I mentioned, that we have lost on eating fresh items from the market. So I usually encourage my patients to eat a lot of fruits, a lot of salads, so that whatever uncooked food that you ingest, you get more of micronutrients. We also call them antioxidants, which are not just helpful for good hair growth, but they're also necessary for a good skin health, to prevent aging and to reduce your pigmentation. Also, there are micronutrients like copper, selenium, zinc, manganese. All these items are usually lost in overcooked food. So we have to consume a lot of uncooked food in the form of we can take fruits, and we can take a lot of salads. So we get these. Plus there is vitamin A, vitamin D, vitamin E, and vitamin B also in some forms. Deficiencies can lead to hair loss. So we try to correct those with the help of supplementation. So vitamin D deficiency is very, very common in India. I get so many females from well-to-do families eating good amount of food and a good quality of food items. But calcium, vitamin D, and protein deficiencies are very, very commonly seen in especially women.
Okay, quite interesting. So, doctor, is it required to take these nutrients as per gender RDA requirement, or is it okay we take it like blindly?
No. Taking it blindly is never an advice which I would give, because the vitamins are of two types. One is water soluble vitamins, which is vitamin B and vitamin C. These water soluble vitamins are excreted from our body on daily basis via urine, right? So their excess or their hypervitaminosis is also a problem, So we are only talking about deficiencies here. So I have seen many people popping tablets blindly just because some friend told them, or just because they saw it online, or it was recommended to them by some friend. So whether knowing whether you're really deficient or not, if you keep on popping these vitamins, there are vitamins like vitamin A, vitamin D, and vitamin K, which is fat soluble vitamin. That means they are dissolved in your body fat and they are stored for a very long time. So if you are popping mindlessly tablets containing these vitamins, they can get stored, and finally you can have hypervitaminosis A or hypervitaminosis D syndrome, which also leads to hair loss. So, just because my friend is taking it, or just because she was advised by her doctor, you also taking the same, nutraceuticals also can harm you. People feel that these are nutraceuticals, वो तो medicines नहीं है, कोई भी ले सकता है. But we don't know the intricate way these nutraceuticals are processed in our body, and the nutraceuticals, if stored and if are in excess, also can lead to problems. So I would always recommend that you have to consult properly, understand what are your deficiencies, and only take those according to your lifestyle, diet, and of course your gender.
Okay. So it is very important to consult with the doctor instead of blindly taking these pills.
Yes.
So, doctor, we are talking about hair loss. So in hair loss, we also there is another common problem which is faced by all of us is dandruff. So does dandruff can also cause hair fall?
Yes. So dandruff, there are a lot of myths about dandruff. People feel that the dandruff is problem of hair. So many patients tell me that we have gone bald and now we should not have dandruff. So let me clear this myth for everyone here. The dandruff is a fungal infestation of scalp. It is a problem of skin and not a problem of hair per se, right? So shaving of your head is not going to relieve you of dandruff. And dandruff is caused by a fungus called as Malassezia furfur, which is there to stay on human scalps right from birth till death. So we cannot really eradicate that fungus and get free from dandruff, as opposed to many beliefs. Many other places, beauty parlors or hair care attendants, they promise that after this treatment your dandruff is going to go away forever. Permanent dandruff treatments are available at many places in parlors. So I want to clarify that dandruff can never be treated completely. It can only be controlled. So dandruff causing fungal population can be reduced. It cannot ever be eradicated from our scalps. So using anti-dandruff lotions at night while sleeping on the scalp and washing it off in the morning, also using some anti-dandruff shampoos containing ketoconazole or salicylic acid, which reduces the sebum production of the scalp, can also be tried. But twice in a week, you have to continuously use these products to keep your dandruff in check. Secondly, in humid conditions like this, oiliness of the scalp increases. So if your skin is oily, if your face skin is oily, mostly your scalp skin is also oily. So such individuals, we ask them not to oil their scalp. You can oil your hair strands, but not the scalp, because that oil mixed with your sweat becomes a very conducive environment for this fungus to grow more. Okay. So definitely dandruff causes hair loss, but controlling dandruff can control hair loss because of dandruff.
Okay. Quite interesting, doctor. So can, like nowadays, even with dandruff, we are also facing a lot of stress. We are not sleeping on time. So is there any impact of stress also, like on hair health? Not
Yes,
sleeping.
yes. Yes, I have already mentioned this factor that lifestyle has got a huge role to play in your hair health, because if you're not sleeping properly, you are stressed, you're thinking all the time, you are under pressure, you are under performance pressure, you have targets to attend, you cannot have sound sleep at night, you sleep very less, or you feel sleepy the whole day after that. You're thinking, you are under depression, or you have anxiety issues, even that can lead to hair loss. Definitely, every human being, whoever is scared or whoever has emotional issues, can face hair loss.
So, doctor, like we all are facing stress in some and any some, like all of us face stress in some form, and we can't avoid it. But at our homes, our mother keep telling us कि चलो stress हटा लो, massage कर लो अपने बालों को oil से. So, is like oiling is a ban or a boom? Will it help to, I mean, release the stress or help in hair growth?
No, I would like to clarify one very big myth here. Oiling your hair is neither a boon nor it has any bad effects, right? So, as I mentioned, if your scalp is oily, then continuously keeping oil on your scalp will only increase dandruff and will cause acne on the face and back, because all this oil that you apply on the scalp and keep it there for like a night or 2 days, 3 days. Some people are always with oil on, especially men. Men have a habit of oiling their hair before leaving for work in the morning. So if your skin is oily, then oiling your hair or scalp is not recommended. But definitely, to relieve stress, if you want to massage your scalp, it is not oil that is always required. You can massage your scalp even with aloe vera gel, or you can massage your scalp with oil, and you can wash it off in 1 hour. That's, of course, I mean, what your mothers and what our grandparents have been saying is true. Massaging your scalp is always a very, very soothing experience, can relieve stress. Oil is not required. So
And
you can use oil or you can skip oil. Oil is just a moisturizer.
just a moisturizer, it doesn't help in hair health.
No, no. The way our TV advertisements have been showing us for years together that oil is reaching the hair follicle root and it is, nourishing. That's not true. Whatever nourishment you can give your hair, you have to put it here and not.
Yeah. Quite interesting, doctor. So, doctor, can you give us some important tips for healthy hair?
Yes, important tips for healthy hair nowadays is that nowadays we treat our hair a lot. We go to parlors, we do a lot of hair treatments like hair straightening treatments. We do hair keratin, we do hair botox, we do chemical coloring of the hair. We want to look good, we want to have well styled hair. So we give heat treatments also a lot to the hair. But at the background of this, we forget that we are supposed to, when you are growing a plant, you have to put nutrition in the soil so that the plant grows well. Same thing applies to your hair here also. The only thing that we forget while we are doing all these chemical treatments a lot to our hair nowadays is that we have to eat well. So proteins become the most important factor in the diet that you have to boost to keep your hair and bones healthy. Your hair and bones almost are made up of the same kind of composition. So your hair is made up of keratin, which is a protein which cannot be put like that, as against how most of the shampoos and most of the parlor treatments are advertised that we are putting keratin in your hair. So you cannot put keratin like this. Your body makes keratin when you eat enough proteins. So if you're not eating enough proteins, then your body is not going to make keratin and you're not going to have healthy hair. So high protein diets in the form of sprouts in vegetarian people, we can get it through milk, paneer, soya bean, sprouts. And in non-vegetarian people, we can also get it from eggs, meat, and a lot of dairy items, right? So protein intake has to be increased. We have to, especially in females, we have to look at the hemoglobin level. So hemoglobin level, if it is down, then also you are tend to get hair loss. So what happens is some females, they bleed a lot, during their menses, and usually their hemoglobin levels are low. So hemoglobin and vitamin B12, they go hand in hand. If your hemoglobin is low, your B12 is also tending to be low. So you have to treat iron deficiency anemia. This is called as iron deficiency anemia, which is very common in females in India. That has to be treated. Again, calcium and vitamin D3 deficiencies are also very, very common in Indian women. So we have to address that problem also through diet and through nutraceutical prescriptions. Secondly, if you have any hormonal issue, most of the times we do not check ourselves in advance. Only when we get hair loss, then the doctor asks you to check your thyroid status or your ovarian status by doing a sonography. So I advise females, if you're facing hair loss, please get your thyroid levels checked every year, because low thyroid hormone or high thyroid hormone both can affect hair very miserably, and they can have hair loss. PCOD is a very common condition in females, which is usually not diagnosed till very late, wherein even females lose hair from the crown area of the scalp. So you have to get yourself screened with sonography of the pelvic area to know whether you have PCOD or not. So I think these are the tips which mostly get missed. And the most important that I want to advise younger public watching this YouTube live is that there are a lot of attractive items available online to be used, but just buying them mindlessly, trying to use them and trying to get results is not the way to treat your hair or to keep them healthy. The basic idea is to eat healthy.
Yes, yes. Yeah, quite true, doctor. It is very true that we need to eat healthy. Doctor, this discussion was very informative, and I'm sure our viewers would be benefited by it. So, doctor, it's time to take some live questions from our audience. So, can
Sure.
we take?
Yeah, please.
So, doctor, our first viewer is asking, is it true that coloring your hair will damage it or make it more white hair?
Now there are different hair colors which are available. The ones which we use for coloring our roots, people color hair to hide the white hair. So when you are putting hair color right from the roots, you are putting chemicals onto your scalp, and they are coming in contact with your skin. They are getting absorbed inside. So most of the hair colors also have bleaching agents in them. So these bleaching agents, if they are coming in contact with the scalp, they may lead to more gray, further the area of what your already gray hair were. Most of the hair colors have very aggressive bleaching agents, which definitely take toll on the texture of your hair, making them frizzy and look like literally threads after few months of doing the coloring. Of course, first it looks good, and after that it suffers. But using sulfate-free shampoos, sulfate-free shampoos are very mild cleansers with less of sulfates, which make your hair go lesser frizzy. And then you can use a conditioner or hair serums containing sunscreens to cover those colored agents. This will help you retain the color also longer, and this will help you to keep the texture also smooth and not let them become frizzy.
Okay. So the same viewer is asking that if hair color quality matters, then how would I know that this color should I go for or not?
Now, that's a very difficult question to answer, because there are n number of brands available in the market, and all these brands are cosmetic brands, right? So like how our pharmaceutical products have to go through stringent Food and Drug Administration monitorings, and they have to be in the line of what do you say, allowed, what can I say, composition. So in cosmetic industry, usually such guidelines are not provided. So companies can keep on changing their ingredients, their compositions from time to time. So ideally speaking, no brand, however expensive that brand might be, cannot be trusted to keep the ingredients safe. So really cannot guide here.
Better to go and ask your salon person. Yeah. So, doctor, another question by the viewer is: do people with dry scalp are more prone to dandruff? Yeah.
Yes, people with dry scalp also are more prone to dandruff. In such people, we also advise to use antifungal shampoos or antifungal lotions, but they can oil their hair. If the scalp is dry, then you can oil your hair. But if your scalp is oily, then you should not.
Okay. Interesting, doctor. Another question, even I want to know the answer. Very interesting. Can hair straightening affect the quality of hair?
Of course. Yes, yes, it does. So I usually tell my patients, because the funny thing is that patients come here and tell me that because I was having hair loss, I did this keratin treatment or I did this Botox treatment in the parlor. Now I'm seeing less hair fall. So it amuses me that these people are so well convinced that some chemical treatment which is made to do, what happens in straightening treatments is your hair is usually has disulfide bonds like this, right? So when you apply chemicals to this part, that bond is broken.
Okay.
And that hair becomes limp, as if paralyzed, and falls straight, which ironically looks good.
Yeah.
Because then you don't have to worry much. You can get up in the morning, your hair is straight and limp, and you look good with that. Of course, yeah, true, that is. But you have paralyzed the hair bond, making them weak, and you haven't helped them in any way. So, of course, after doing these treatments, 3 months or 4 months later, you start noticing more hair loss, because the hair which grows out is your original quality, which is with the bond, and the hair that is straightened is like that. So this is the place where the hair breaks, and you get a lot of breakage after 3 to 4 months of doing such chemical treatments on your head.
Okay. Okay. Very interesting. So, doctor, another interesting question by our viewers: can a hair spa treatment help with hair damage and repair?
Only temporarily, I would say, because as you were saying that oil massage से stress कम होता है, तो hair spa से भी stress कम होता है, और I would say कि कुछ दिनों के लिए आपके बाल अच्छे दिखते हैं, right? But after that, it is back to pavilion. So it cannot be regarded as a treatment. It's a spa. So treat it as spa and don't expect more from it.
Very interesting. So, doctor, one question by our viewer is, as you said that if your skin is oily, then you should not apply oil to your scalp. So, is there any test to know that what type of my skin is?
Yeah, but see, if your skin is oily on the scalp, you know it, because your hair becomes greasy very soon. So mostly oily scalp people have to wash their hair frequently. And see, when your face skin is oily, your scalp skin is also oily. So that becomes a better judge. But usually oily scalp होता है तो लोगों को पता होता है कि मेरा scalp oily है.
Okay. So, doctor, another question is, ma'am, I would like to know if there are any natural remedy or home treatment that can improve hair health. Yes.
Of course, I mean, natural remedies ही तो मैं बता रही हूँ कि आप अच्छा खाओ, ये इससे नेचुरल और कुछ नहीं हो सकता आई फील। बट जैसे डैंड्रफ ले लिया हमने, तो डैंड्रफ के लिए बहुत पहले से चलता आ रहा है कि हम नीम के पत्ते लगाते हैं, या एलोवेरा जेल लगाते हैं, या कर्ड में नींबू मिक्स करके लगाते हैं। तो ऑल दीज आर होम रेमेडीज which can curb down dandruff and make your scalp little healthy but moisturized. So aloe vera gel helps for moisturizing the hair. So I was just telling you before also that instead of oil, you can also massage your scalp with aloe vera gel, which acts as an excellent moisturizing factor to the scalp. Also, instead of chemical coloring, if you switch to henna, which is naturally occurring remedy, wherein you can add all sorts of, you can add egg, you can add coffee, you can add aloe vera, you can add amla powder, and to make your hair smoother after that, because as we know, all hair colors, including henna, dry your hair later. So you have to moisturize your hair when you are chemically coloring it. So these are the ways to, keep your hair healthy by using home remedies. Only thing is that home remedies are time consuming and we tend to do them only very rarely. So that does not help. It requires constant attention.
So, ma'am, as we are running out the time, I will ask the last question from our viewers. Ma'am, how to prevent hair from graying? Please suggest, ma'am, how to prevent hair from graying.
The most important question is what age person is asking this, because usually now we say that the human race is aging faster than it used to before. So nowadays, if a person is more than 25 years of age, we generally tell them that graying is part of aging now. So relax. But if you are less than 20 years of age, or if you are a kid and you already have noticed graying in your hair, then that's called premature graying of hair. So in premature graying of hair, there are, again, it's a multifactorial thing to approach. It's not always deficiencies of vitamins that leads to hair graying. Previously, it was believed that biotin deficiency or PABA, para-aminobenzoic acid deficiency, or calcium pantothenate deficiency was only leading to hair graying. But no, that's only one factor. डेफिशिएंसी अगर है तो भी बाल ग्रे हो सकते हैं, लेकिन ओवर एक्सपोजर टू सन also can lead to graying of hair. A lot of stress in your life also can lead to graying of hair. So बहुत बच्चों में हमने देखा है कि कोई स्ट्रेसफुल पीरियड के बाद बाल बहुत पक जाते हैं, बट बाद में वापस नॉर्मल भी हो जाते हैं. They tend to turn black again. But वापस बाल ब्लैक होना ये आफ्टर age of 25 years or 30 years possible nahi hota hai. So usually we do not say that. So eating high protein diet, biotin rich foods, calcium pantothenate आपके डाइट में होना चाहिए. So basically जो मैंने आपको पहले कहा कि स्प्राउट्स खाओ, अंडे खाओ, और जब भी आप धूप में बाहर जा रहे हैं तो बालों को कवर्ड रखिए. So that is one biggest tip to avoid premature graying of hair.
Very interesting, doctor. So, doctor, would you like to give a take-home message or any other suggestion to our viewers today?
Yes, my take-home message is visit your dermatologist first and not as the last resort after you've tried all the online stuff and all your parlor advices. So try and meet your dermatologist first and have a scientific approach towards your hair health. Thank you.
Okay, doctor. Thank you, doctor, for sharing so much of information and all your expertise with us today and for answering all the questions of our viewers. I'm sure viewers have found this session very helpful, and thank you, doctor. It was a delight to have you, and thank you for your valuable time.
I hope I have helped, and it was a pleasure to me to be invited here as a speaker. Thank you, Mona.
Thank you so much, doctor. Thank you, ladies and gentlemen, for joining us today. This is Mona Sharma, your host, signing off for today.
Bye.